Italy is in lockdown. From tomorrow, people throughout the country will be unable to move freely. Prime Minister Giuseppe Conte has signed a decree, Restate a casa, stay at home. Schools and universities closed. Public gatherings, bars and sports events stopped. Italy is experiencing an increase in infections of COVID-19 and resulting deaths.
The numbers are increasing by about 20 to 30% a day. That's the number of cases testing positive. And so are the admissions to ICUs and unfortunately the deaths.
We've seen a really rapid growth in the number of reported cases in Italy. There's evidence that there was undetected transmission, potentially for a few weeks, that meant that when the cases were first detected, you were seeing illnesses that may be more severe, they'd been infected a while ago.
Doctors in Lombardy, which had experienced the initial brunt of COVID-19, have told Newsnight that around 10% of people who test positive for the virus end up in ICU. They say that all the ICU beds there are already full and patients are now being transferred out of the region for treatment. The Lombardy region has more hospitals than other parts of Italy, they say, and even then routine procedures have been cancelled. For example, out of 21 cardiac units, 17 will not take on new patients and the others will only do emergency procedures. Doctors, patients and their families in the region are having to make tricky clinical decisions about whose treatment should be prioritised to ensure appropriate allocation of limited healthcare resources.
The system is of military origin. It was first of all thought out by Napoleon's chief surgeon, Baron Larrey. And the idea is that you select those for treatment who are most likely to benefit. And that's because it starts from the idea that resources are finite. Triage is ethically and morally very difficult, personally very difficult to apply, but you have to apply it in situations like this.
Newsnight has seen the guidance. Those with the greatest chance of successful treatment will take priority for an ICU bed. Age, any underlying illnesses and the severity of the disease will all be taken into account. This chimes with a study published today in The Lancet about deaths from COVID-19 in Wuhan. This found men, people who were older, those who developed more severe organ failure and sepsis had higher risks of dying. Putting in measures to delay the spread is critical to slowing the epidemic curve so the health service isn't overwhelmed and resources can be best used. The quarantining started in Lombardy and local regions. Over the weekend a report was leaked about the lockdown, but some people simply moved south to stay with relatives. Doctors told Newsnight that they were worried about the impact of this. Now everywhere is shut down.
As far as the Italian government is concerned, it seems to me that they have done all they can. There are measures and certainly they have put down some clear rules. Whether Italians are going to follow those rules, that's a different matter.
So how unusual is this picture in Italy?
I think we've now got data from multiple countries, so we're doing real-time modelling analysis of about 15 countries now, and the early epidemic growth without good control in place is pretty consistent across countries. On average, each person's infecting 2 or 3 others. We're seeing doubling every 4 to 5 days, and it's not just one country. We're seeing maybe around 10 countries in that current phase. So I think it's very clear that if there's no good control and if, for example, advice around control measures is ignored, we could easily see that growth continue.
With lockdowns and quarantines, we're in uncharted territory in peacetime Europe. It's unclear how long Italy is willing to keep these restrictions in place and who else will follow suit.